Have you ever met a 14-year-old who has beaten cancer not just once, but twice? Those are the types of patients that trust us, Jackson Health System, with their care. This December is our month of miracles. Join us as we dedicate this month's episodes to the incredible stories of resilience, perseverance, and triumph of our patients here at Jackson. Welcome to On Call Off Script, the Jackson Health System podcast. I'm your host, Ruel Champion. We're sharing the story of Jake Alexander Kleppen, the 14-year-old known as Instagram as Jake the Victorious Warrior. As you can imagine, every warrior deals with battles, and for Jake, he beat his opposition of cancer not just once, but twice. It also wasn't a battle he fought alone. Right by Jake's side is Marisel Jarrin Kleppen, his mother, and Dr. David Crawford. He's the director of Pediatric Stem Cell Transplantation at Holtz Children's Hospital and a physician at UHealth, the University of Miami Health System. Now, with that mouthful said and done, Jake, we need to get to know you. Tell us a little bit about yourself, but we're going to do it rapid fire style. First, your favorite food. Second, your favorite thing to do. And third, tell me one sentence that describes you or how your friends and family would paint a picture of you, my friend.
Favorite food, favorite thing to do, and something that describes me that my friends and family would say.
Yes, sir.
Okay, favorite food, probably steak. Favorite things to do, flying drones, and anything aviation.
Okay.
And what else? Something that people would use to describe me. Resilient.
Resilient. Is that your one word? Okay.
Resilient.
Steak. How well done do you like your steak?
Medium rare. Typically.
Medium rare. That's
but
the way to do it.
I can't really have that because, the whole bone marrow transplant thing. So now I have to get it medium.
But we'll look forward to that time that you can have it.
It's very depressing, guys.
Oh, my goodness. And in all due time, I'm sure you'll have your medium rare steak, my friend.
Yes, I hope so.
Marisel, it sounds like you've got a teenager full of personality, to say the least. So talk to me about that. Talk to me about who Jake is in your eyes.
I think that every parent thinks that their child is special, and I believe wholeheartedly that he is. He is super humorous, as you guys can tell. Mm-hmm. He is, like he said, resilient. He is strong and so brave, and he's my favorite person in the world. Don't tell his siblings. No, they are all my favorite, but each child has a special bond with their parent, and our bond is something that is indescribable.
Wow.
He is a twin flame of mine. He is just, it's hard not to love him.
Yeah, and he gets
amazing.
It from his mama, right?
He gets it from his mama.
That's so special. So let's talk about the medical journey. When did you start noticing signs of something being wrong with Jake?
So there was never a moment where I thought my child is sick. And that's what makes this so scary. It was September 13th, Friday the 13th of 2019. And we were on our way to, I'm a teacher where he goes to school. So we were on our way to school and work. And he and his brother Justin are in the truck. And Jake says, Mom, today is Friday the 13th and it's a full moon. So something scary is going to happen.
The stars are aligning.
And I, kind of chuckled. That's silly. That's a superstition. Nothing's going to happen. And so that day after school, we had a well check at his pediatrician, just a well check. And the pediatrician noticed that his eye was a little bulgy and swollen. And Jake has something called hypertrophy, where his eye sockets are not aligned. So I just thought that was the misalignment. We had seen the specialist a few months prior, so I didn't think anything of it. But she looked at him and said, I want you to go to the emergency room. At first, she thought it was sinusitis and that, he might need some draining. And already I was petrified. I thought how scary to have that drained, that's so invasive. Little did I know that when we got to the ER after imaging, they saw a mass behind his eye. And so they sent us to Bascom Palmer in an ambulance. And I feel like everything happened so quickly, but also so slowly at the same time. So immediately we were received here. And although it was very scary, we also felt safe and nurtured from the first healthcare worker that took us in until today.
Right.
And they determined that the mass behind his eye was cancerous. He had stage 3 Ewing sarcoma. It was scheduled to get his port placed, and chemo started immediately.
Wow.
He was 8 years old when that happened.
Yeah.
And no time to, as moms, we want to get everything, logistically ducks in a row. And there was no time. It was, our world just completely flipped.
Yeah.
And at that time, his biggest concern was, Mom, am I going to lose my hair? That was
that's what I want to ask you, Jake. What was going through your head, boss?
So, as a kid, I didn't really know anything about cancer,
Yeah, of course.
Before that, I was like, okay, like, what's going to happen to my hair?
Right.
Basically.
Yeah.
But then eventually, as time went on, I realized, oh, this is worse than I thought it would be. This is way worse. Because I've only thought about cancer from there's advertisements about kids in hospitals with cancer.
And those advertisements show the kids happy in the hallway playing.
Yeah, so I didn't really think anything.
And what stands out is the no hair. So we went into it. I didn't know. So of course the news was delivered to me. I didn't know how to deliver it to him. And so I asked for the psychologist, and we delivered the news together. And of course I feared the question, am I going to die? And he didn't ask that. He just asked about his hair. He was young enough that I can shelter him. And so what Jake knew at that time was, you have cancer, it's an illness, and we're going to do everything that we can to make you better.
Okay.
And so it started.
I didn't really think people died from cancer.
Well, you were 8.
I was 8. Yeah, I didn't know. But then after I got it, I realized, okay, people definitely die from this, and this is way worse than I anticipated. I'm not just going to lose my hair. I'm going to lose my weight. I'm going to lose my facial structure. I'm going to lose everything.
Wow.
And my social life.
Right.
All of that. I couldn't go to 3rd grade. I missed all of 3rd grade. Luckily, I went to 4th, and I'm doing okay now. But
good.
it was not until a week later that I realized, oh, this is way worse than
once
than
the
I
chemo.
thought
Once
it
he
was
got
gonna be.
chemo on, and he felt very sick.
Yeah. Well, I can imagine doctors like you, Dr. Crawford, delivering this news to families or even starting the treatment plan. It can take a big toll, but can you talk to us a little bit about the beginning of Jake's treatment plan and what the plan of attack was?
Well, the first thing you need to know is really what the disease is. So a tumor in the face could be many different things. It could be a rhabdomyosarcoma, a Ewing sarcoma. It could be a lymphoma. And while they all kind of sound alike and they all are cancer, the treatments are vastly different. And you would have minimal effectiveness if you gave the wrong regimen, and you certainly wouldn't cure the patient. So a diagnosis needs to be made, and I would presume that they did a surgery to get a little piece of it so the pathologist could figure out what it was. True?
There was a biopsy.
Yeah. So a biopsy was done, and then based on where it is, we have a good idea what it might be, but we don't really know until the pathologists do their work. So they take this bit of tissue and they get it sliced up and stained and do some special stains to differentiate different things. And so usually about 2 or 3 days later, they would come back with a diagnosis. In this case, one of Ewing sarcoma. And then at that point, we would tell the family and the patient what the tumor was, and propose a treatment regimen and get everything going. They mentioned the port, which is a portacath, which is it's essentially a big IV that goes in, that allows us to draw blood, and it's sort of stably placed in the patient, so it doesn't come in and out. It stays there for the duration of the treatment. So he had a portacath placed in preparation for that, probably at the time the biopsy was done. And then when they got the result, then we would come with a treatment regimen, show them what we needed to do, and then begin the treatment shortly thereafter.
Right. And Marisel, what's going through your head as we're starting treatment, we're doing chemo, and Jake's starting to feel the effects of that treatment?
I feel helpless. I feel helpless. I feel, it's a dark world. It's a dark world. And, you have such a great medical team.
Right.
But a piece that's missing is mental health support. That's something that I feel that every parent walking this journey needs.
Yeah.
Someone to hold your hand, preferably somebody that has walked the same walk
Right.
with you. And that's when you start reaching out, and I've been blessed to meet some wonderful people. Although I hate how I've met them, they've been very impactful and have helped me. Because it's scary, and I think the most difficult part is trying to divide myself among my children. I have to be there for the child that needs me the most, which at that point was Jake. And so I was dedicated to Jake almost 100% for those 11 months that he was in treatment.
Oh,
So it was
almost a
11
year.
months, almost a year. So almost a year of me being absent from the life of my other children. So it was very, very difficult.
All right. From what we understand, that first round of cancer, we beat it.
We beat it.
So how did that feel for you both?
I felt like a lot of weight just got off of my shoulders, you know, like, oh my God, I can live again. I can finally breathe now.
Yeah.
You can finally go back to being a normal kid.
Yeah.
Right.
And I was until the second one.
Yeah. Let's talk about it.
But I think what, we were bamboozled because when you get to the 5-year mark, you're considered a survivor. And so here we are. I'm on edge the whole time, right? So year 1, when you get frequent imaging and blood work, and I'm like, okay, he's no evidence of disease. We're good.
She'd
Year
celebrate
2,
every time.
we'd celebrate. We have, every year that he is cancer free, we celebrate. And so year 2, I'm trying not to feel as anxious. Year 3, oh, he's got this. We're good. Year 4, and when we are just a few months shy of year 5 of him being a survivor and celebrating this huge milestone.
Kaboom!
Yeah.
It happens.
He's part of Civil Air Patrol, and he went to an encampment, which is you can explain this part, which is a boot camp.
Yes.
Yeah. So Civil Air Patrol, for those of you who don't know, is
Most of us don't know, my friend.
Yeah. So it's basically an auxiliary of the United States Air Force.
Okay.
And what they do is they have people go on search and rescue missions and all that. And I'm in that. I'm currently in airman first class, I think.
Wow.
Or either that or senior airman.
He's been out this whole year that he's been.
But like I could fly planes there if I wanted to. They're called O-rides.
That's really cool.
And I have before. I've flown on 172s, Cessna 172s. But there was an encampment, which is basically like a boot camp for the Civil Air Patrol, and it was in, I forget the base name.
It's in North Florida.
It's in Jacksonville, in Florida. But we go there, right? I'm fine. I'm doing fine on the bus ride there. It was a long goodbye from my mom, and she was sobbing because her baby's going away for 1 week.
Jacksonville's far, Jake. It's a far drive.
Her baby's leaving for a week, so she's sad. But when we get there, it's like cold. It's like, I think like in the 30s, maybe 40s. And I'm not used to that.
No, not growing up in Miami.
No.
And 4 a.m. wake ups.
Yeah, 4 a.m. wake up.
And a lot of physical activity.
But for context,
tell me.
I don't really get sick easily. Especially before this. Like my immune system's like super strong.
Right.
I think genetically it's just super strong.
It's tough.
Right. So for me to get sick, that's like super rare. That's like
right.
Once every like couple months. If that. But so I get to the graduation, and I was not feeling well. My legs were cramping. But they were cramping. My throat was very sore.
Yeah.
I felt dizzy. I felt like I was gonna fall every step I took.
Interesting.
But I pushed through, and I went to that parade, that graduation parade.
How did it feel to be able to do that?
Pretty crappy. But like when I look back at it, like I pushed through that, so that's pretty badass right there.
It is, my friend.
But but we go through that parade, right? And then my dad's like, "But you good, buddy? You look pretty drained over there." And then I'm like, "Oh, I'm fine." But my legs are like cramping all the time. And fast forward the drive home, we're in a van. We were in like a van, a Civil Air Patrol van, CAP, and everyone's sick. Like everybody in the van is sick. And normally, if I didn't have cancer at that time, I would be able to like, take that,
And take it and
like-
it'll just go off
like-
your back.
Yeah, right. I would be able to like take deep breaths the whole ride
Yeah.
and not get sick.
Yeah.
But I got sick. I got like mycoplasma, pneumonia, the
Oh my
flu.
goodness.
I got
But we didn't know that until he got
Yeah.
home, and I just
I
attributed.
got home.
Yeah.
And on the drive home, like my dad got into his car at an airport. And then we were driving home. My legs couldn't stop cramping. They're like, ah. He's like, I was on the ride back. I was searching. Why do I have rashes on my legs? Why do I have?
Him and his
Why
phone.
do I have purple?
Google
What?
University.
Google, Dr. Google.
No, I searched
Yeah.
on Mayo Clinic. Why do I have rashes on my leg?
Yeah.
And so like there was multiple results, but my eyes widened like leukemia rashes, and I'm like, oh crap. Like
Yeah. So
Yeah.
from there,
so I kept calm for mom, like,
Yeah.
but I kind of like saw it coming already. I'm like, do I have cancer again? No.
Did you
please.
mentally prepare for that
I'm
news?
mentally prepared for that news, yeah.
Mm.
But it couldn't stop me from like, I couldn't hold back. I was-
Yeah.
Yeah. When they told me, I was just like, am I gonna live? Like, am I gonna survive? Like,
I mean, you were older.
what's
you
the
have-
survival rate for this?
Yeah. You have questions now. Dr. Crawford, is that where you come in that second diagnosis?
Yes, it was. In fact, so I first heard about Jake from our weekly weekend sign out. So what happens is that doctors take turns on being on duty on the weekend, and
Yeah.
we send a report to everybody on the team at the end of the weekend. And I, as I said, I had not known Jake before, but I got this weekly email, and so there's this young man that was treated previously for Ewing sarcoma, and now he comes in with low blood cell counts across the whole range of counts. All of them are abnormally low. So in my mind, I was pretty certain that it was going to be what we call a secondary leukemia, a leukemia that's caused by the first treatment.
Oh, wow.
So I was pretty sure it was going to be AML, but because that's the most common secondary leukemia. But
What
Jake
does
had a
that
very
stand for, if I can interrupt? I'm sorry.
acute myeloid leukemia.
Okay.
That's usually what the secondary leukemias are, but in his case, he had an unusual version of acute lymphoblastic leukemia, or ALL. But in either case, those secondary leukemias are very hard to treat. So I pretty much knew that's what it was, but it took about probably almost a week to be certain that was the case till we had the firm diagnosis.
Yeah. And what are the next options? Is it straight to bone marrow transplant, or did you present other cases?
So we knew that he would need a bone marrow transplant because he
Yes.
would not be cured otherwise.
Mhm.
But we also know that bone marrow transplant by itself is not adequate. A patient needs to begin the transplant process already in remission. So we need to have beaten the leukemia down to where we can't see it, so the transplant can get rid of those vanishingly small numbers of really bad cells. So my colleagues and I treated him for leukemia for about 2 months, and then we did the transplant after he had no evidence of residual leukemia. Now, of course, no evidence doesn't mean it's not there. It just means we can't see it.
Right.
So that's why because of that, the transplant can be effective. And so we did the transplant together.
Yeah, and that's not an easy process, guys. I
is not
donated
an
my
easy-
bone marrow to my little sister, and my part was the easy part, right? So talk to us, all of you guys.
Yeah.
What happened?
My brother is actually my donor.
Yeah.
He was a 100% match.
Yeah.
Dr. Crawford can confirm that.
It's true.
Yeah.
Yeah, we feel so
And-
fortunate.
Yeah. And the transplant was successful. No? It was successful.
Perfectly.
Yeah.
That's amazing.
It was.
But the process to get there is not easy.
The
Yeah, no,
process and the
no.
mental strain. And if I can
was
just
isolated.
Yep.
yeah, Jake having cancer at 8 and 9 years old versus Jake having cancer as a teenager. You
Two
know, I
different
think any
experiences.
parent of a teenager can agree that just a teenager by default is difficult.
Yeah.
So imagine a teenager dealing with the isolation and, and now he's so astute and so knowledgeable. And it got to a point where I had to say, we asked the doctors questions, because if you get on the phone again, I'm going to take it away. He was getting on the phone and researching himself and, going to places that are very dark.
Bad habit.
And I didn't think that it necessarily pertained to him. So, I would say if you have questions, we ask our medical team. We want to make sure that he's getting the answers that are correct.
Yeah.
And he wouldn't make himself go crazy and spiral and and depressed.
Yeah.
So it's been really hard this go around with that. But I always say that Jake is the definition of when life gives you lemons, you make lemonade. And now he has upgraded that saying. He goes, no, Mom, I don't make lemonade.
When life gives you lemons, you pelt them right back at it.
You pelt them right back
at it. Listen, you got to take life into your hands.
Yeah.
Yeah. So we try and make the best of even the worst situations, so it gives us time to bond. During his first battle with cancer, we chose a show to watch. It was Stranger Things.
So good.
And at 8 years old, he felt so special. Oh my gosh, I'm watching Stranger Things. So that was our show. This time around, it was Breaking Bad.
Nice.
So it's always, and I'm always like, oh my goodness, these nurses are going to judge me because I'm letting my child watch this. But, I've become such a yes mom, which, it's good and a bad thing. But I feel like he's been through so much.
Yeah.
Yes, you want to dress up as, a colonial soldier to go to clinic. Go ahead, Jake. And
I do that.
Yeah, he does.
If it gets to the point to where whenever I don't go in costume, they're always questioning me.
Yeah.
Not when I go in costume, then they just don't question.
Yeah, that's
it.
Jake.
You're bringing personality to the environment, right? Sometimes clinic can be kind of repetitive, I can imagine. So.
Whenever I'm not in costume, they're like, Jake, what's wrong?
I bet.
Yeah,
Dr.
we try
Crawford,
to
if I can ask you very quickly, just seeing Jake now and his personality shining, how does that feel like for you?
Well, it's really spectacular. Although I'll tell you, he had the same personality throughout.
Oh wow!
Even when he was really quite ill, he still would stop and talk to me and make jokes and entertain me. So rounds were always a joy, even when I had to deliver some bad news.
Mm-hmm.
Oh yeah,
it's amazing.
Listen, if you get bad news, make fun of it.
Yeah, man.
Make fun of it.
It seems
that's my way of staying positive. At least, like, just make fun of it. If someone gives you bad news, okay.
It seems like your philosophy is to make things light, right?
Make things light, yeah.
That's amazing.
It's kind of like a coping mechanism, kind of.
Oh, absolutely.
So that way, like, if you get like bad news, then you don't feel as sad if you make a joke about it. Yeah, just smile.
And it looks like you're contagious, right? You like to make other people smile just as much as you do.
Mm-hmm.
I like that personality.
Everyone knows going into the hospital room to see Jake that
it's gonna be fun.
I
can tell,
I'm
my
very
friend.
extroverted.
I can tell.
So being isolated, that took like a big mental toll on me.
Yeah.
Like I got spiraled into like depression and all that. Like.
Yeah.
Like I didn't want to do anything because like I didn't have social life.
Yeah.
I couldn't hang out with my friends. So
right. But
I couldn't make friends.
You've seen the light at the end of the tunnel.
I did.
Right? And so what's next for you, Jake? Are you going to high school?
Yeah, in January. In January.
Where are you going?
West Broward High School.
Wow. Are you excited?
Yeah.
Mm-hmm.
Tell me about it.
So
Tell me
excited.
more. What grade are you going into?
I'm going into 9th.
Okay.
And I'm just super excited for like the social aspects.
Yeah. You're going to be the small fish in the big pond, my friend. I'm excited for you to take over that school.
I'm going to be the big fish in the pond of small fish.
There you go. We are flipping the script. And so what do you want to be when you grow up? I feel like I'm ready to see you in front of the bright lights. I want to see you on TV one day.
Okay.
So many things.
So actually, it's not what you expect. So first off, I wanted to be in a U.S. Army combat medic.
Mm-hmm.
And I don't think I'm qualified for that anymore because of the transplant and everything. And yeah, but I have backup plans. I've always had backup plans. Like my life plans were always like, you know, economical, political, social, and like employment. I have all those like
skills
planned out.
Yeah, you do.
I have it planned out. So my plan B was become a history professor at a college.
Wow.
And then probably part-time, like fly planes privately.
That is really, really cool. Well, next time I need a private jet, I know exactly who I need to call.
I also had a plan to work for an aeronautics company, probably like Boeing or something, and like build
the planes.
So that's what I was. Yeah, that's what I was getting ready.
engineer.
That's what I was getting ready to say, Jake. That although you may not be able to fly the planes, you
can
still
build them.
Yeah, he's
Fix them.
like, well, Mom, it's okay. I can help build them. I can help fix them.
Yeah.
So he sees, other opportunities.
Help with concepts and everything. Yeah.
Well, I'm excited to see you shine. Thank you all for your time today. We really appreciate it. Your story is truly something special, my friend.
Of course.
Thank you.
Jake's testimony is a true reminder of the importance of gratitude. It makes you remember to cherish your loved ones this holiday season, especially when stories like this one exist. With a little bit of hope, plenty of science, and added passion, miracles at Jackson can happen and come to life. Stay tuned in as we have another heartwarming patient story during our month of miracles, and be sure to follow us on our social media at Jackson Health.